In this video, here's what we'll cover: why anxiety can feel stuck, which anxieties EMDR may suit inside an EMDR session, what improvement can look like, is EMDR right for you? Picture the moment before you walk into a crowded room, or press send on an email you have read 10 times over. Your chest tightens, your thoughts start to race and loop. Part of you knows there is no real danger here, yet your body has already braced as though there is. If that feeling is familiar, you are far from alone, and I want you to know there is a way to work with it. Anxiety is so much more than feeling nervous before a big day. For a lot of people, it is a daily companion that shapes their thoughts, their feelings, and even how their body behaves. Talking therapies and medication can genuinely help, but many people keep searching for something that reaches the part of anxiety that words alone do not seem to settle. That is where EMDR comes in. It was first developed for trauma, and it is now showing real promise for anxiety too. Let me start with why anxiety can feel so stuck. Anxiety is not simply in your head. It is a whole body response that runs through your nervous system. When something feels stressful or frightening, your brain and body react fast. Your heart speeds up, your muscles tense, your thoughts sharpen. For some people, those reactions get stuck in the on position, so the body keeps responding as if there is danger, even when everything is safe. Very often, that alarm is linked to earlier experiences. Maybe you were embarrassed in front of a class, or felt lost and small as a child. Even if you cannot picture those moments clearly, your brain still holds them. When something today occurs, an old memory, it can set off anxiety with no real threat in the room. Talking therapy, like CBT, helps by changing how you think about your fears. And that matters a great deal, but it does not always reach the emotional memories stored in the brain and body. EMDR is designed to work with exactly those. So which anxieties might EMDR suit? Research suggests it can help across a range of presentations. With generalized anxiety disorder, or GAD, where worry attaches itself to almost everything, EMDR can help by processing the memories and beliefs that feed the constant worry. With panic disorder, where fear arrives in sudden, overwhelming waves, it works on the memories and body sensations tied to those attacks, and may ease how often and how strongly they come. For social anxiety, it can gently process the memories of painful or embarrassing social moments, so being around others feels less threatening. And for performance anxiety, whether on a stage, a sporting field, or in a meeting, it can target the fear of failing or being judged. These are educational examples, not promises, and what fits you is something we would work out together. Now, let me take you inside a session, because the unknown is often the scariest part. EMDR follows a structured, phased approach, and the memory work never begins until we have laid careful groundwork first. Early on, I learn your story and we choose what to focus on. And I teach you grounding and calming skills you can use anytime. Only when you feel ready do we move to the processing itself. From there we pick a specific memory or situation, along with the negative belief attached to it and the kind of belief you would rather hold. While you briefly bring that memory to mind, I guide you through sets of gentle bilateral stimulation, usually side-to-side eye movements, and sometimes soft taps. This helps your brain reprocess the memory so it carries less charge. We then strengthen a positive belief, such as, I can handle this, and we settle any tension left in your body. Every session closes with grounding, so you leave feeling steady. A typical session runs about 50 to 60 minutes, and most people find it far more manageable than they expected. What can improvement actually look like? Everyone is different, and simpler patterns of anxiety may ease within roughly 3 to 6 sessions, while more layered situations take longer. Many people describe feeling calmer in situations that used to set them off, fewer physical symptoms, like a racing heart or sweaty hands, more confidence to try things they had been avoiding, and often better sleep and a lighter mood. The evidence suggests these gains can hold over time, especially alongside healthy coping skills and good support around you. So, is EMDR right for your anxiety? It can suit people of all ages and backgrounds. It is often worth exploring if you have tried other therapies without full relief. If you feel stuck in your anxiety, or if you are simply open to a different approach. When you meet a therapist, it is fair to ask whether they are trained in EMDR, what experience they have with anxiety, and how you will track progress together. And you can prepare by being honest about your experience, practicing the skills you are taught, and giving yourself patience, because this is gentle, steady work. Anxiety does not have to run the show. If you are ready for a new approach, I would be glad to help. You can read the full guide, or book an appointment, using the links in the description below. Our practice, Potentialz Unlimited, is right here in Bella Vista. Before you go, here's a quick recap of what we covered. Why anxiety can feel stuck. Which anxieties EMDR may suit. Inside an EMDR session, what improvement can look like. Is EMDR right for you? And one small thing that really helps more people find this. Subscribe for weekly mental health explainers. Like this video if you found it helpful. Share it with someone who might need it.